Welcome to the fifth program in our series about family involvement and care. This program builds on earlier content about communication, assertiveness, negotiation, and partnership agreements. Today, we'll start to talk about challenging behaviors that go along with the dementia disease and what message those behaviors may be sending. As a reminder, this program is one part of our training series about creating a partnership approach to caregiving, which involves working as a team with providers to assure your loved one with dementia receives the best possible care. Being a partner with providers relies on good communication, negotiation, and clarifying roles, as well as asking questions or for explanations, bringing up concerns with the care routines or treatments, and being prepared. Challenging behaviors are common with dementia care and are often a source of disagreement between family members and providers. Keep in mind that there are a wide range of behaviors in dementia, and they are often associated with changes and losses of abilities. Challenging behaviors often trigger tension between family and providers related to the care for the person with dementia. Questions may come up such as, have the person's abilities declined? Does the care plan need to be changed? Is the care plan not being used effectively or consistently? And at times, there may be disagreements about the reasons for the behaviors. Having a shared understanding of the changes in abilities can help to reduce tension and help family and providers work together as partners to better understand what the behaviors may be telling us. Behaviors can be very challenging. Let's take a look at a few tips on managing behaviors from family caregivers. Involve family members immediately when a provider is experiencing a behavior concern. Problem solve with the team about concerns. You have vital information and suggestions which may help. Embarrassing behaviors and personality changes that come with dementia can be difficult for family members to cope with. Take time for yourself and your emotions and allow yourself to grieve during these changes. It is important to note that changes in behaviors relate to several things, including a gradual loss of abilities. While this may lead to a risk of behaviors, it varies from person to person and doesn't explain everything. There are also factors in the environment to assess, such as unmet physical, social, and psychological needs, as well as physical illness, such as acute illness, chronic illness causing pain, and psychiatric illness like depression that can all contribute to behaviors. Behavioral symptoms also vary by the stage of dementia. The early stage of dementia is often characterized by what may be observed as typical forgetfulness. Dementia is often not recognized or diagnosed until the person reaches the middle stage, where confusion and cognitive changes are more apparent. The middle stage of dementia is the stage where behaviors are more common, as losses of abilities and function are more prevalent. Behaviors may include irritability, agitation, anxiety, and pacing, as well as resistance to care assistance. Before we dive into factors in the environment, let's take a minute to discuss another way to look at challenging behaviors in dementia care. It is important to view behavior as a form of communication. Cognitive changes may contribute, but they often don't fully explain the presence of behaviors. Look for unmet needs and also be aware of the stimulation of the environment, as that may be a key. Keep in mind that how family caregivers and providers behave and respond has a powerful influence on the person with dementia and may contribute to undesirable behaviors. Many of the behaviors we label as being problems are the result of unmet needs. Take a minute to think about what the behavior might be telling us. Are they wandering because they are bored and looking for social engagement? Are they grabbing or hitting because they are experiencing pain? There are many possibilities, but taking a step back to analyze can help to uncover the root cause. Let's take a quick break for a discussion. As we have discussed, behavior in dementia is a form of communication. In what ways have you experienced this? Please pause the presentation to allow time for discussion, and then start again when you are ready to continue. Now let's take a look at some of the physical factors in the environment that may contribute to challenging behavioral symptoms. There can be any number of unmet physical and emotional needs that need to be considered. Is the person experiencing pain? An illness or infection? Are they hungry, thirsty, or tired? Perhaps it is a sensory impairment. Check to see if they are wearing their glasses or if they need to be cleaned. Check hearing aid batteries to see if they need to be replaced. The person with dementia may not be able to communicate these needs, and undesirable behavior may be their only form of communication. Next, we will look at psychological factors. Just as unmet physical needs contribute to challenging behaviors, so do unmet psychological needs. Is the person experiencing loneliness, boredom, fear, worry, lack of meaningful activities or socialization? Are they experiencing a loss of intimacy or lack of privacy? Learning to be aware of these psychological needs is an important skill for all family and staff caregivers. Often, psychological factors of the environment go hand in hand with social factors. Let's discuss. The social environment can contribute to behavior. Ask yourself, are there too many people or too much noise? Is there too little to do? Is the communication unclear, or is the care not matching the person's abilities? When thinking about communication, it is important to be aware of the style we are using. Is it too long? Are we using too many words? Are we speaking too fast or hurried? Or is it simply too complex for the person with dementia to understand? Are our expectations realistic? Do not use phrases such as try harder or you could do it yesterday. These statements are simply not effective and will only cause frustration and agitation. Along the same lines, what is our approach to providing care? Are we focusing on the person, their preferences and abilities rather than the task at hand? Are we communicating what we are doing throughout the process? Are we invading their personal space or sense of privacy? It is important to keep the person in mind and tailor the care to their long-standing habits, patterns, and personality. The final factor we will look at today is the physical environment itself. Take a look to see if the cause of the behavior may be related to the physical environment. Does the environment lack appropriate signage to reduce feeling lost? Is the background noise, such as the television, radio, or overhead speaker, confusing? Are pictures or reflections misunderstood? Does the environment lack natural walking paths for physical exercise? There are many pieces to the puzzle, but with practice you will start to look for and recognize unmet needs to proactively respond to your loved one's needs in order to reduce challenging behaviors. Let's take some time for a breakout discussion. Both family caregivers and providers may not realize that their own behaviors, such as rushing or raising their voice, affects persons with dementia and may contribute to undesirable behaviors. In what ways have you experienced this? Please pause the presentation to allow time to discuss, and continue playing when you are ready. Sometimes the contributing factor may be an overlapping illness such as depression, anxiety, psychosis, delirium, or other mental illness. It is also important to note that delirium, or acute confusion, can overlap dementia. While dementia is irreversible, delirium differs, as it is an acute disorder that causes confusion, but is reversible when the underlying cause is treated. Some causes of delirium include infections, low oxygen levels, dehydration, electrolyte imbalances such as sodium or potassium levels, sensory deficits, or side effects from certain medications. Identify and treat the delirium and underlying cause to help reduce behaviors. When factors are contributing to challenging behavioral symptoms, keep in mind it is important to take the time to assess the person and the situation to help identify if the behavior is related to the loss of abilities, if it is a long-standing habit, if it is an unmet need, or if it is signaling a new health problem. Use this information to direct your response. How can we best meet their needs? How can the care routine be adjusted? Or is it time to make a new plan? We will discuss these topics further in our next presentation, Responding to Behaviors.